Bulanaka and welcome to Hope Channel Fiji, particularly to our series, the Oral Health and Overall Health. Thank you for joining us today. And of course, we welcome our guest, Dr. Nimaya. Thank you very much for your time and coming back today to join us in clarifying some of these, areas of oral health and overall health. And of course, today, we are looking at the characteristics and functions of the temporomandibular joint.
Yes.
And where is it again? It's right here.
Right here, in front of your ears.
In front of your ears. And
the joint that moves every joint.
Joint.
Yeah, it's like the master joint, eh?
Yeah. If it doesn't move, what happens if it doesn't move?
Well, we can't even breathe.
Yeah, if it doesn't move.
It has to move in order for us to breathe.
Yeah,
it has to move in order for us to walk. Because it's just right next to your mind, your brain, the system of coordination from head to toe. So it has to go via that temporomandibular joint.
Okay. So just before we continue on to this new topic, Doc, let's just have a look at some of these, the pH scale.
Oh, yeah.
We have the water here.
Yes.
Okay,
What's the pH of the water? Can you just...
let's have a look. pH of the water here is... my glasses are not even strong enough.
Let me read it.
Yeah.
pH 7.7.
7.7.
Yeah, so Fiji water has got a very neutral pH, 7.7, which is just, it's like the mouth pH, and it's just neutral, and it's...
Okay. So we have acidic to the left, and neutral, and alkaline.
Right.
Yeah. To the right, eh?
Yes.
And we see 7.7 is just
in the middle.
Towards, middle, which is...
Because the scale is from 0 to 14, eh?
Yes.
So 7 is just the mid number, and it's neutral, and we see the water sits right in the...
So that is the pH, this pH scale, that is...
Yes.
Actually what the body needs, eh?
And the pH scale is, it is like at the power of 10. Yeah, so those numbers are the properties of the hydrogen is just not, it's got a very wide power of 10, from 1 to 2, 3 to 4. So we see that pH of that water, if it goes around 5, then it becomes acidic. So it sits at 7, it's neutral, and it's good for the mouth and good for the whole body.
Yeah, when something is acidic, it's bitter in the mouth and
acidic. Acidic also hosts the functions of some bacteria in the mouth.
Okay.
Yeah, and like that acidic environment and sweetened beverages, and that's why on the last session that in order for us to have healthy mouth, one of the number 2, I think, is that we should drink lots of water.
Yeah, drink lots of water.
Yes.
Lots and lots of water.
It just neutralizes everything, and it's just right pH for the mouth, and even our blood is just hovering on the 6th and 7th pH.
Even cleaning it, and we have a lovely toothbrush here from Korea, so
yes,
that we can use.
Yeah, we have to use water for cleaning purposes, for drinking.
True.
And because it's just the right medium for the mouth environment.
Okay. All right, let's have a look at the common health factor there. Would you like to just take us
common health factor approach? And we see here the diet, stress, the control, hygiene, and smoking, alcohol, exercise, injuries. When this lifestyle, the lifestyle, they come through a common factor. And one of the factors that is really leading in this situation is the diet. So we say good diet. One saying, you are what you eat. Yeah.
Just see the arrows. The
arrows
that come from the diet. It goes to obesity, cancer, and heart diseases, and
dental caries.
Yes. And okay, so
Yeah.
then we have smoking there. It also has quite a few.
And smoking has
arrows.
got 4 arrows: cancers, heart disease, periodontal disease,
Trauma there.
and respiratory disease.
Yeah.
Yeah. So we see all the factors, whatever we do in eating, drinking, and even what we think.
Yeah.
Yeah. Even in what we think, it has got implications on our physical health. Yeah. And emotional.
True.
Yeah. So it's very important that we understand what we believe in. Yeah. And what we eat and drink and what we do. Because they've got all factors, eh?
Yeah, all those health factors
either for good or for bad.
Affect our health. And much of this, it's taken through the mouth.
Through the mouth, yeah.
Yeah. So, okay. All right, let's thank you for reviewing that for us, Doc. We'll go back to those every now and again.
Right.
At the beginning of each episode. So we'll move straight into our characteristics and functions of the temporomandibular joint, or TMJ.
Man.
And so we look at the character of God. We read it in our last episode from Exodus chapter 34. Verses 6 and 7. Eh?
Yes, can you just read it again?
Yeah, I'll read it to you from our New King James Version. And it reads, "And the Lord passed before him." This is before Moses. Because we will be looking at Moses also.
What an encounter.
Yeah, we'll be looking at, we talked about Moses when God spoke to him and wanted him to do something for him. He gave a lot of excuses, just like you and me.
By the way, that talking happened in the mountain, eh?
Yes.
Yeah.
And
the early morning.
He gave those excuses. He said, because he's got this
stutter.
Yeah, he stutters a lot. And he gave an excuse. No, I can't speak. And then God said, "Who gave you that mouth?" And it's interesting because he spoke about the mouth. Eh?
Yes. And God even said, "You go, I'll be with your mouth."
Yeah.
Because God is the word. Eh? So what we say is just the air, but then it's a very wonderful how this air turned into vocals.
Yeah.
And
which results in action.
Yes, results in action.
So, we have your mouth, my mouth.
And let's control. Where the TMJ, because TMJ is a translation joint, it's the moving joint, it's the how it maneuvers everything. Yeah? It's amazing.
We are just wonderfully made. Yeah. And the Lord passed before him, this is Moses, and proclaimed, "The Lord, this is Lord, capital L, capital O, R, D,
all capital.
Which refers to God, yeah? God the Father.
That's amazing.
Okay. The Lord, God, merciful, right? He's merciful, he's gracious, he's long-suffering.
Third.
He's abounding in goodness.
Fourth.
Truth.
Fifth.
Keeping mercy for thousands. Forgiving iniquity. And transgression and sin. And by no means clearing the guilty, visiting the iniquity of the fathers upon the children and the children's children to the third and fourth generations."
He's a just God, eh?
Just. So just, yeah. So all those iniquities, third, fourth generations, he's willing to take that away. That's God. It's a God of love. Yeah. So we're looking at those.
That shows that nothing that we do is hidden from God.
Yeah.
And that's good, eh? Yeah, because He cares for us. Yeah. So He wants us to be always in a
good position. Okay, so let's have a look at the characteristics. We'll look at the characteristics of the temporomandibular joint.
Right.
Then we'll look at some disorders.
Yes.
So we need to understand those disorders because when we look at some other aspects of the TMJ, we will be referring to these disorders.
Yes.
So we need to look at that first.
Yes.
Okay. Now, these characteristics and functions. Okay, to connect the characteristics to the functions of the temporomandibular joint, or TMJ, and any disorders caused by a negative attitude. Negative attitude towards the character of God.
Oh.
Yeah. So that's dangerous.
Yeah.
Okay. So we need to draw some parallel between physical health, okay, specifically for the TMJ health, and spiritual or emotional well-being. Okay, let's break it down. Now, we look at the characteristics and functions of the TMJ. First one there, would you like to talk to us a little about the mobility and flexibility of the TMJ? Characteristics, mobility and flexibility.
Moving and it's flexible. And it's wonderful, eh? When we think about it, eh? Out of 1,000 words we say every day, and how this flexibility and mobility ensure that we talk. And no, okay, the TMJ allows for movement necessary for chewing, speaking, and facial expressions. Its characteristics include rotation and translation. No, it's wonderful how this joint works.
Can move in multiple directions.
Yeah.
So that way,
it's rotation, it rotates, and translation. Eh? The joint can move in multiple directions. Oh. It's amazing. Eh? Yeah,
forward, backward, that way, that way.
And remember, it's happening in seconds. Eh? That's just so the amazing God of how he. That's everything we can say. The biology, the physics, the chemistry, everything is working. But we just can't understand, fully understand.
Joint.
It's amazing. It's
and
amazing.
It's resilient. Okay, so what do we mean? It's resilient.
Yeah, it's resilient. The joint can handle significant forces. Remember, when we eat, when we chew very tough foods, it must be tough. But when after eating, then we don't feel any pain. Because it's resilient.
It can handle any.
It can handle
any type. Sometimes we see people they're very quick to use their mouth. When they're trying to untie a knot or something,
sometimes
very quickly to put their teeth in. No, but they don't need to do that. Otherwise, they're hurting their joint.
Yeah, it's a rotation joint. It's translation. Move in multiple direction, allowing for complex. That's the word. That's very significant. It allows for complex jaw movements.
Sure.
We're just using it without even understanding, take into deep consideration how this TMJ works. But it allows for complex jaw movements. And for resilience, this joint can handle significant force. Just try and think if you yourself try to bite your finger. Then that's a force. The more I put pressure, then the more pain.
Yes.
But then this joint can handle significant force during chewing and grinding. Eating of hard foods, like example, chewing sugarcane. There's a big force going on there.
True.
And sometimes we can't handle the force.
Just try to skin it. And the young people, they have those things are stronger. Once you get older and older, at my age,
the muscles and the teeth lost, all those things compromised.
But they all assist. They all help.
They all
good
help.
set of teeth.
Yes.
And
muscles,
the jaw,
and strong bones, and and with a strong.
The interesting thing also that we need to remember is the lower jaw that does the moving.
Yes, the upper jaw don't move.
The upper jaw is static, but the lower jaw is the one that's moving. And I remember while in Papua New Guinea, I had problems with my jaw.
So you got talking from experience,
very painful. It was locked. So I went to the hospital. And then they were trying to help me there, but they didn't. There was no result. So they eventually sent me to the dental department.
That's where.
There was a lady there that I was directed to her, and she told me to do an exercise.
She must be a specialist, specialist in TMJ.
So to exercise my jaw, I had to do this, and I push my jaw down. Like that.
Exercise.
Push up, and I'm going down, pushing. But it's amazing. After that, I was able. That was from eating peanuts. In there, we eat a lot of peanuts. Peanuts are sold on the road, just like here. Selling beans there.
They are peanuts,
The raw peanuts, But, that's mobility and flexibility.
Yes.
And you can get locked jaw. That's the best exercise that I have. And I use it all the time when I feel my jaw is painful. I just do that exercise. Anyway, how about support and balance? Number 2.
Yeah, it's an awesome joint. Yeah, I can say it's a wonderful joint. Yeah, because this wonderful God, He created us wonderfully. No wonder King David, he said, "For I am fearfully and
Wonderfully made.
Yeah, man, that's something about this king that he even study about his being, and that's very important. That each individual, we have to know how our body functions, and we have to take time and think about how our body works. The physiology and the anatomy, or how we made up, and or the functions of our body, and that allows this king, I'm saying, to say, I am fearfully and wonderfully made. Okay, for the support and balance, TMJ support the lower jaw. Yeah, as you can see, it's only the lower jaw that moves. Yeah. Upper jaw does not move.
Yes, when this one moves, our TMJ also moves.
Yeah. So you can also see that the TMJ it supports, or it is your face. It is your image, because it's the joint that forms up your facial system.
Appearance.
Yeah, your appearance, and it supports the lower jaw and the mandible. The upper jaw is called the maxilla, and the lower jaw is the mandible. And that's why we have that mandibular. And helps balance the forces exerted during various activities. We tend to be just talking and eating and doing things for granted.
We don't even take time to think.
Even take time to think and to relate it to God the Maker. Then that's just not.
No, just now I mentioned that, I'm thinking, what are the different types of activities that I engage my lower jaw in? My mouth.
As we have said, that TMJ moves activities 100% 24/7, and these activities, even in silence, even in silence, even in sipping, even in blinking of eyes, moves. It must move, and that's why I'm saying this is a very wonderful joint, because it's just the joint just right next to your brain system. And it's the only major joint in the face.
Support and balance. Okay.
Yeah, support and balance, and the forces exerted during various activities. And the alignment. Okay, we need to have proper alignment. We've got left and right TM joint. They themselves, they've been there for balance. And for proper alignment of the TMJ ensures efficient functioning and prevents strain on the muscles and ligaments. So we see for the joint, it needs the muscles, it needs the ligaments, and it needs fluids. They are all there, which we don't even take time to appreciate. But now it's time that everything that breathes have to praise the Lord in Psalms 156. Because all these mechanisms, we don't create it. We don't. We just use what...
We just take advantage of what is already there. We don't even take time to think about it.
To understand. Believing, understanding life in action. And I think now it's time for us to take a step back and think how this wonderful joint is doing for our humanity.
Okay, so the TMJ works in coordination with the teeth and muscle for smooth movement.
Oh, yes. Now we
are just putting the food and then that's it. We don't even consider that they have to work together. The tongue has to push the food that way and that way, send it to the molars.
Coordination, working together.
So when they don't coordinate, that's when you bite your tongue.
Yes. Sometimes when you're not thinking and you're just eating, and then they bite your tongue, you bite your lips, and you feel
something is wrong.
Something is wrong, and then you might be stop talking and just continue with your eating.
This is interesting. Well, this is really interesting.
The coordination. Temporomandibular joint works in coordination with the teeth. And muscles for smooth movement. Works in coordination. For example, when you just said bean, the piece, the bean,
And they
and
sell
peanut,
in the bus stop.
yeah. No, how it works in coordination from the mind to your mouth, to your teeth, with your hand, with your fingers. When you put the bean, the peanut, you straight away you will have to throw it right at the back because it needs some molar teeth.
Subconsciously, you
Yes.
think subconsciously. You're not
Yeah.
even thinking.
Right,
You just
yeah.
put the bean there and say the bean and the peanut. You go and buy from the bean cart.
Yeah.
Mix bean and peanut, please, and some of those other things. The
Yes.
sayo. So when they all go into the mouth, like you just pour it here and you put it in. But your tongue just subconsciously, they
They just push it
they
right
sort
at the
them
back.
out, eh?
Yes, so
Put
they sort them out.
Yeah.
That's coordination.
Yeah.
Yeah, you did not put the bean in front. You know, you don't chew. You don't incise the bean.
Okay.
You have to chew the bean. So
Yeah,
just go to where
Go to the back.
where the teeth
And
is
the
meant for.
sayo might be in front.
Yes,
eh?
sayo might be in front.
Sometimes you, like for me, I have to be conscious now. If the job is not well done, it's not supposed to be at the back.
Yeah.
My tongue will just push it up to the front. And
How the coordination? It's very fine coordination. Yeah.
okay,
Coordination with the teeth and muscles. You must remember to the muscles. And it's just wonderful how we are created.
how about the third one there? Protection and healing. What
Yes,
that refers
protection
to?
and healing. You know, the
Protects itself.
TMJ, the health of the TMJ needs to be at the optimal care. It needs optimal care. TMJ's mechanism to protect itself, like it's auto protection.
It's amazing. Eh?
Yeah, it has got mechanisms to protect itself and heal from minor injuries. Cartilage and synovial fluid. These components cushion the joint and reduce friction. You know, all the joints, from the TM joints, your knee, your toes, they have cartilages and ligaments, and they have fluids for lubrication.
That's why we have to drink a lot of water.
Yeah,
which,
water helps,
because
everything that we do helps.
A lot of people complain with knee pain,
Might be
joint pains. The fluid is in the cartilages.
the fluid there. And
There's no fluid.
Yes, and water and and healthy eating and healthy drinking, they help in healthy, just like the fluids, the cartilages and the of the joints and of the body as a whole.
It's interesting, the adaptive remodeling there.
Yeah.
The joint can adapt to changes and repair minor damage over time. Wow.
Oh,
Some of us want to go and repair it ourselves. No, the thing will just repair itself over time.
It's amazing, because since this is the most used joint, so it undergoes wear and tear, and some injuries happened or what in the teeth or in the mouth or even in the joint, because it's being used 100% all the time. But then it caters for its own healing mechanism.
Yeah, thanks for that, Doc. So let's remember the characteristics and functions of TMJ. There's mobility and flexibility.
That's very good, because
support and balance, okay. And protection and healing. It protects itself, heals itself. And we can just praise God for how He has created us.
Yes, how He has created us. And
all right. Now, when we do not look after it, there are certain disorders.
Yes.
Some disorders that we need to look at, because it's important that we see this, because when we go into the characteristics of God's character, and we'll look at the letters of the alphabet, it will refer, some of that will refer to the disorders or the negative attitudes that we have. Okay.
It reminds me, there's only two ways.
Yeah.
Whether it's good or
bad.
So it's good that we have started with a positive and with a
positive. Now we look
and
at
now
the
we come to
negative.
disorder or negative.
Okay. Disorders of the TMJ can arise from various physical and emotional factors. Okay. A negative attitude towards the character of God can manifest as stress, anxiety, lack of trust, which can have physical repercussions on the TMJ. Okay, so here's how. Here is how it can have that physical repercussions. So the first one is what? Stress and muscle tension.
Stress
Tell us
and
a bit
muscle tension. Okay, it's very important that we see that TMJ, the disorders of TMJ can give rise to physical, our body, and our emotional emotional factors. And we can see in there that stress, anxiety, and lack of trust. One verse came into mind. Cast all your care upon me.
For he cares for you.
For he cares for us. Yeah, and then he said, bring all your burden.
Yeah.
And for my burden is
Cast
light.
your
So we can see, it said here, if you have a negative attitude towards God's character, then it will manifest.
Yeah, that's stress. And
I remember, well, it happened to Adam and Eve. They got stressed when listening to the bad information from the devil. Yeah. And then their son, Cain, when God said, hey, what's happening to your face? You look sad and you look...
Your face is down.
He's downcast. Because he's having this negative attitude towards God's character.
Yeah. That was why he got stressed.
Yeah, he got stressed. The muscle.
Murdered the brother. And it's interesting
so
when the muscle is tensed and stressed, it leads to, how do you pronounce that? Bruxism.
Okay. Stress and muscle tension. Negative attitude can lead to increased levels of bruxism. That's like you teeth grinding.
You're sleeping and you hear people as if, like the rat, knowing at something,
but knowing at your teeth. The teeth,
No. And it's interesting that God also, so you'll be cast out, and where there'll be gnashing of teeth and
weeping.
Weeping and gnashing of teeth. So we're talking about gnashing of teeth here.
Yeah. And you see, weeping, that's emotional factor. And gnashing of teeth or bruxism or grinding, that's a physical aspect. And I remember that I was telling someone, when you fist,
when you go like this,
same time your mouth sort of
everything, the face gets distorted,
and your teeth meet each other, which should not be
angry. Okay,
so negative attitude can lead to increased stress levels, bruxism or teeth grinding. Stress often causes people to grind their teeth, especially during sleep, leading to TMJ disorders.
Okay. Because, so remember, folks, when you grind your teeth in your sleep, you're making your TMJ, giving it a disorder.
Yeah, like when our teeth, this is stress, really, no wonder we said and that's very very hard for the TMJ, very hard for the face, very hard for the brain, it's got all those negative.
The muscles in the face are not relaxed.
And even the blood vessels, sort of the blood does not really flow because you've been having that negative attitude towards God's character.
Yeah, thank you, Doc. Time has caught up with us again.
Oh, yes.
And thank you for, we looked at the characteristics and functions of TMJ, and we've just started on the disorders or on the negative attitude. The first one on the negative, the disorder of the TMJ, and that is the stress on the muscle, the tension on the muscle of the TMJ.
Grinding of the teeth.
Yes, and thank you for being with us. We'll stop here for now, and please stay with us in the next episode. We will continue on the TMJ disorders and negative attitudes. God bless you, and Samwade.
Thank you.